Okay, cardiac cycle. We're going to start the cardiac cycle in this bit that I've already gone on screen here, mid-late diastole. And there's a couple of things we need to consider in order to understand it. And the first thing is, what the hell is going on? Well, the events that happen in mid-late diastole are as follows. And that is primarily that blood is returning to the heart. Blood is returning to the heart. So where's it coming from? It's coming from the vena cava, and it is coming through the pulmonary veins. We have got some valves that I have drawn into the heart, and as you can see, these valves are open, which means the blood is going down through those valves and into the ventricles. There are other valves we've got to consider, and these are the semilunar valves that are in the aorta and the pulmonary, good God, I can't get my words out, the pulmonary arteries. So these are the aortic valve and the pulmonary valve. Okay, so blood is coming in through the vena cava, the pulmonary veins. So vena cava, plural, from the superior and inferior vena cava. Okay. Blood is flowing in, atrioventricular valves are open. So what's going to happen if this situation continues, which you hope that it will, because if it doesn't, it means that you're dead. Well, what it means is the ventricles are going to fill with blood. So the ventricles fill. Okay, to what? And that is to something about 70%. Okay, 70% of what? 70% of the end diastolic volume. So in other words, 70% of the volume they're going to have at the end of diastole. Awesome. Right. What does this mean to pressure? Well, it means the pressure inside the ventricles, pressure in the ventricles, is still quite low. No, low compared to what? Low compared to the pressure in the atria. That's why these valves are open. Valves open when the pressure is low, the way that the stuff that's going through those valves is going towards. So if the pressure in the ventricles is lower than the pressure in the atria, then these atrioventricular valves remain open. AV valves open. The semilunar valves, that's these chaps up here, they're closed. Why are they closed? Because the pressure in the ventricles, so the ventricles have a direct effect on the atrioventricular and the semilunar valves. The pressure in the ventricles is lower than the pressure in the arteries that these guys are in charge of. So pressure in the ventricles is lower than pressure in aorta and pressure in the pulmonary artery. Awesome, that's nice and easy. What happens next? Well, what happens next is that the conduction system plays an effect. So the sinoatrial node will fire off. If the sinoatrial node fires off, it spreads a wave of depolarization through the atria. Okay, where does that wave of depolarization then go? It goes into the atrioventricular node, down the bundle of His, into the left and right bundle branches, and into the Purkinje fibers. So what happens? Well, the atria depolarize because there's a wave of electricity, wave of electrical excitement going through them. That causes a P wave on the ECG, which means the atria depolarize. So that is the next phase of the cardiac cycle. Next phase is atrial systole. What does systole mean? It means when the heart is doing work. Atrial systole means the atria are contracting. Right, okay, what's going to happen now? What's going to happen now is these atria are going to contract. They're going to squeeze like hell. and they're going to push the remaining blood into the ventricles. So the pressure inside the ventricles is going to go up. So in atrial systole, blood still returned to the heart, ventricles now fill. To their end diastolic volume. Because we're coming towards the end of diastole because we're starting to do systole. Okay. Now, the pressure inside here is going up. It's going to go up such that that gets replaced with this. So the pressure in the ventricles becomes greater than the pressure in the atria. Something's now going to happen. These atrioventricular valves will snap shut. Why do they snap shut? Two reasons. This is filling and filling and filling and filling and filling. The pressure increases. If pressure increases, we know the valves close. So these guys now change shape. And I'm going to just draw them in black. Like this. They snap shut. But, big but, the pressure in the ventricles is not great enough to overcome the pressure in the aorta and the pressure in the pulmonary arteries. So the pressure coming here is still greater than the pressure that is generated here, which means these guys stay shut. That's atrial systole. Next thing, the heart can either be working or it can be relaxed. So atrial systole will give way to atrial diastole. And then the atria will stay in diastole. Let's just finish this off. Semilunar valves. Closed. The atria will stay in diastole until such time as the cardiac cycle comes around again. Okay? Big, big thing. Right, let's do some tidying up here. So, remember, the heart can either be in systole or diastole. So, we've done mid-late diastole, we've now gone into atrial systole. The atria are now going back into diastole because something cool is happening. Let's get rid of this as well. Something really cool is happening. And I'll tell you what's happening is the conduction system is really starting to kick into high gear. Okay, so the wave of depolarization that has gone through those atria is now going to work its way further down the conduction system. From the sinoatrial node, it goes and depolarizes the atria. Then it goes down the bundle of His and it forms something called the QRS complex as it works its way down here like this and then up there like that. And then it gives way to an ST segment. So the QRS complex is ventricular depolarization. And if the ventricles depolarize, they will eventually contract, and that happens here in the ST segment. Okay? So that's ventricular contraction. Ventricular contraction. And in ventricular contraction, these guys, the ventricular myocardium, start to squeeze. And they start to squeeze really hard. And it gives way to something called isovolumic or isovolumetric, either are acceptable, contraction or systole. Isovolumetric systole. So let's translate that into plain English. Iso, no change. Volumetric, no change in volume. Systole, contraction. Which means the atrioventricular valves are closed. Excuse my phone. The semilunar valves stay closed. But the ventricles are now contracting, which means the intraventricular pressure, the pressure inside the ventricles is starting to go up and up and up and up and up. Which means the blood wants to work its way out, but it can't. So there's no change in volume, but a lot of change in pressure. So these valves, they're now closed in black. Atrioventricular valves are dying to pop open. Semilunar valves. These guys are going to stay shut. because things can't go back this way. Now, these guys are dying to pop open, but they can't. Okay, they just can't, because the pressure that we're making isn't great enough. So if you imagine the top of the aorta, it's like this, the atrioventricular valve there, and there's pressure coming back from the rest of the body onto this valve. The ventricles are contracting, and they're trying to push blood through, but the pressure here, I'm going to make it with a big P, is bigger than the pressure there. When the ventricles create enough pressure that this P overcomes that P, and it becomes like this, then that valve pops open and blood can go out. So then we go into ventricular ejection. The atrioventricular valves are still closed, but now the semilunar valve is open. The semilunar valves open, so we can draw them in like that, and now blood will go out of the ventricles, either into the lungs or into the rest of the systemic circulation. After ventricular ejection has happened, the heart can only go one of two ways. It can either be in systole or it can be in diastole. Now we go into ventricular diastole, and we go into the early stage. Early ventricular diastole. Okay, so the ventricles now start to relax, and something cool happens. So if we just zoom in on the top part of the heart, the aorta is here, like that. Pulmonary artery there, splitting off. And we had previously the aortic and the pulmonary valve open and blood going out this way. But now the ventricles are relaxed, which means the pressure inside the ventricles down here is starting to drop. The pressure up here is still big. So what happens? Blood will start to flow backwards. And if blood starts to flow backwards, guess what happens? These valves start to shut. And they do this. So in early ventricular diastole, again, the atrioventricular valves are closed. But now, the semilunar valves close. Okay. So that's the early ventricular diastole. Now, something cool is going to happen again. We've had isovolumetric systole. We're going to have a new thing happening now, and that is not isovolumetric systole, but isovolumetric diastole, or isovolumetric relaxation. This is where blood now will start to flow back. We draw the vena cava right here, and the pulmonary veins here. Blood will now start to flow back into the heart because we're in diastole. So we've done our ejection. Now we're going to do our filling again. So what happens now? Isovolumetric relaxation means nothing is changing in terms of the ventricular volume. Right, okay, so blood is now coming back this way, but these guys haven't yet opened. So in isovolumetric relaxation, the atrioventricular valves are still closed. The semilunar valves are closed. And everything is still low pressure. We then go into late ventricular diastole. this is where all the chambers of the heart are still relaxed, but now we've got enough pressure in the atria to pop open the atrioventricular valves, and blood starts to fill the ventricles, which takes us all the way back to mid-late ventricular diastole, which is where we started. That is a super duper quick way to think about the cardiac cycle.